Hi everyone, I'm Sir July, and for these slide sets, we will be defining what a communicable disease is. We will also be comparing communicable disease from other closely related but different terms. The COVID-19 pandemic has affected our lives in numerous ways. It may be one of, if not the most memorable infectious disease you might have encountered in your lifetime. Test yourself. Do you think that the COVID-19 is infectious, communicable, or contagious? Infectious diseases are illnesses caused by pathogens such as bacteria, viruses, and fungi that enter the body, multiply, and cause an infection. So what are pathogens? Pathogens are defined as organisms causing disease to their host and are also referred to as infectious agents. In other words, these are disease-producing agents. How about infection? Infection is the invasion of the body by pathogenic microorganisms, their multiplication and reaction of tissues to their presence, and to toxins generated by them. The key phrase here is, said multiplication results in tissue damage. Some authors use the term colonization to describe a state when microorganisms, including those that are pathogenic, are present at a body site but are doing no harm and are not causing symptoms of infection. To summarize, microbial multiplication plus tissue reaction or damage is termed as infection, while microbial multiplication without tissue reaction or damage is termed as colonization. This table shows various infectious diseases and the pathogens that cause them. Viruses such as the rubeola virus and SARS-CoV-2 cause viral diseases such as measles and COVID-19 respectively. Bacteria in this table, Clostridium tetani and Mycobacterium leprae, cause bacterial infections such as tetanus and leprosy. Pneumocystis pneumonia or PCP is caused by a fungus Pneumocystis jirovecii. Diseases not caused by pathogens may be classified differently. Shown in this slide are terms used to describe some. Highlighted in this slide are the terms congenital and acquired diseases. Congenital diseases are present at birth regardless of cause, while acquired diseases develop after birth. Diseases are said to be genetic when they are caused by abnormalities of the genetic material. Autoimmune diseases occur when the body cannot recognize self from non-self and tissues are attacked by the immune system. Conditions that cause tumor growth are termed neoplastic. A large proportion of diseases actually do not have known cause. In this case, they are referred to as idiopathic. How about communicable diseases? Communicable diseases are infectious diseases that is spread from one person to another. Pulling back from the previous table, decide if these diseases are communicable or not. You may pause this video to gather your thoughts. If you answered yes to all except tetanus, you are correct. It means that tetanus is an infectious disease, but it is not communicable. In other words, it is caused by a pathogen but cannot be transferred from person to person. The rest of the diseases in this slide are communicable. Remember, I asked you earlier whether COVID-19 is infectious, communicable, or contagious. At this point, we already know that it is both infectious and communicable. But is it contagious? The term contagious is used for diseases that easily spread from one person to another. The R naught, also referred to as the reproduction number, is a mathematical term that indicates how contagious an infectious disease is. It refers to the number that one infected person will subsequently infect. The higher the R naught, the more contagious the disease is. You can see in this illustration that measles has an R naught of 18. It means to say that a patient with measles will subsequently infect 18 other patients. This is significantly more compared to HIV, which has an R naught of 4. Noteworthy also in this illustration is that the original COVID-19 strain has a lower R naught compared to your COVID-19 Delta strain. Therefore, COVID-19 is infectious, communicable, and contagious. Let us summarize the slides. Infectious, communicable, and contagious are descriptors that are best thought of as concentric circles that overlap with each other. The outer ring, or the broadest of these definitions, is the infectious disease, which is defined as any disease caused by a microorganism. The middle ring represents communicable diseases, which are diseases that are transferred from one person to another. You can clearly see in this illustration that the green circle representing communicable disease is entirely inside the yellow circle representing infectious disease. This will easily allow you to note that all communicable diseases are infectious, but not all infectious diseases are communicable. The innermost ring represents contagious diseases, which are communicable diseases that can be easily transferred. Pause for a while, gather your thoughts, and when you are ready, let's have a practice test. The invasion of the body by pathogenic microorganisms resulting to their multiplication and subsequent tissue damage is referred to as A. Infection or B. Colonization. You have 5 seconds. If you answered A, you are correct. True or false? All infectious diseases can be transferred from one person to another. You have 5 seconds. The answer here is false. An infectious disease may be communicable or not. Third question. Tetanus is A. Infectious, B. Communicable, C. Contagious, or D. Any of the options. You have 5 seconds. The correct answer is A. Infectious. It is caused by a microorganism, making it infectious, but it cannot be transferred from one person to another. Therefore, it is not communicable as well as contagious. Last question. A disease caused by a pathogen but cannot be transferred from one person to another is referred to as A. Infectious, B. Communicable, C. Contagious, D. Any of the options. You have 5 seconds. If you answered A, then you are correct. This ends the slide set. Please do not forget to subscribe to my YouTube channel, Memory Aid Nursing.